Morning stiffness lasting more than an hour? Nope. That's not just because you're getting older or need more coffee. It could be rheumatoid arthritis that affects millions of people worldwide. We'll uncover its secrets in today's episode of Disease Decoded series. Rheumatoid arthritis is a chronic autoimmune disease, which means the immune system, which normally protects you from infections, starts attacking your own body, and it sustains in body for long despite of treatment. Imagine your body's defense system, built to protect you, suddenly attacking your own joints. Sounds like medical thriller, right? That's rheumatoid arthritis. In RA, it targets the lining of your joints, causing painful swelling, stiffness, and over time, joint damage. Basically, a case of mistaken identity, like accidentally blocking your mom on WhatsApp, thinking it's a scammer. Have you ever woken up in the morning feeling like your joints secretly had a late-night wrestling match without inviting you? And hey, before your fingers get too stiff, hit that subscribe button to keep your health knowledge flexible. Rheumatoid arthritis affects around 5 to 10% of adult population worldwide. It's more common in women than men and usually starts between ages 30 and 60, but it can happen at any age. So how do you know if it's RA and not just regular joint pain? Here are some common symptoms. Well, if stiffness and swelling keep showing up uninvited, it might not just be old age. It could be something more serious. Joint pain, swelling, and stiffness. This happens because of inflammation of joints, tendons, and bursae. If you are suffering from rheumatoid arthritis, you may observe early morning joint stiffness, lasting for more than an hour, which eases with physical activity. Earlier joints involved are typically the small joints of hands and feet. Initially, one joint is involved, which gradually increases in numbers. Fatigue and low energy, along with decreased range of motion of finger joints, reduced grip strength, tendon rupture indicate towards RA. Progressive destruction of joints and soft tissue may cause permanent irreversible deformities. Usually symptoms appear in symmetry, like pain in both wrists or both knees. Large joints, like knee and shoulder, may remain unaffected for many years after onset of disease. Neurologic manifestations are rarely a presenting sign, but they may involve with progressive instability of C1 and C2 cervical vertebra, affects only 10% of patients. In severe cases, it can even affect your lungs, eyes, and heart, causing subcutaneous nodules, pericarditis, peripheral neuropathy, vasculitis, and blood abnormalities. Like why to stop at one problem, right? Let's clear the confusion first. Rheumatoid arthritis, or RA, is not your typical wear and tear arthritis. That one is osteoarthritis, like your knees getting rusty hinges from years of use. Let us know in the comment if you're interested to have separate video on osteoarthritis. Here's the big mystery. Exact cause of rheumatoid arthritis is still unknown, but it's likely a mix of genetics, environment, and hormones. Some possible triggers include, think of it as a recipe where your immune system just adds too much spices and ruins the whole dish. Heavy smokers are likely to have extra-articular disease and early onset of significant physical disability in patients with rheumatoid arthritis. Certain infections, stress, hormonal changes affects its progression. If you have a family member with rheumatoid arthritis, your risk might be higher too. If you think you might have RA because of genetic association, the first step is seeing a rheumatologist. If you had to blame one, would you blame your genes, your lifestyle, or just bad luck? Let's see what you think in the poll. Doctors don't just look at your joints and say, yup, RA. There is a proper detective work involved. They will run tests like blood tests to check for inflammation and antibodies like rheumatoid factor. Serum IgM, RF, has been found in 75% of patients with RA. However, negative results does not exclude the presence of the disease. Presence of anti-CCP antibodies has same sensitivity for diagnosis of RA. Anti-CCP also indicate towards the prognosis or disease outcome. Inflammatory markers like ESR and CRP are helpful to know its severity and chronicity. X-rays, MRI, or ultrasounds to see if there's joint damage. Involvement of wrist, metacarpophalangeal, or proximal interphalangeal joints means joints of fingers is typical of rheumatoid arthritis. Early diagnosis is the key. The sooner it's caught, the better the long-term outcome. There's no cure yet, but there are effective treatments to reduce symptoms and slow the progression. So the good thing is that rheumatoid arthritis can be managed well with medication. Medications like disease-modifying anti-rheumatic drug, methotrexate for early rheumatoid, biologics like anti-TNF agents, advanced treatment targeting specific parts of immune system, NSAIDs, glucocorticoids such as prednisone, methylprednisolone, etc. Lifestyle tips: stay active, low-impact exercises like swimming or yoga, physiotherapy, weight management can help, but only under advice of expert. Eat an anti-inflammatory diet. Think omega-3s, veggies, whole grains, manage stress. RA can flare with stress and poor sleep. Don't smoke. It can make RA worse. It is important to be under regular follow-up of doctor, since persistently active RA often results in cartilage and bone destruction, leading to functional disability. Some people also find symptomatic relief with acupuncture, massage, or physical therapy. But always talk to your doctor first. And remember, motion is lotion for your joints. The more you move, the less they complain is not always true for all kinds of joint pain. Do not keep suffering the pain, get it diagnosed. Is anyone out there who has used joint pain as an excuse to escape household chores? Be honest in the comment. I won't tell your family. Living with RA is a journey. There are good days and flare-ups. But with the right treatment plan, many people live full, active lives. It's about listening to your body, working with your doctor, and making small, sustainable changes. Let's bust a few myths. Myth: RA only happens to old people. Fact: it can start at any age, even in your 20s. Myth: exercise makes RA worse. Fact: the right exercises actually protect your joints. Myth: eating certain foods can cure rheumatoid arthritis. Fact: no magic diet cures it. But yes, an anti-inflammatory diet helps. So, no, eating 2 kg of turmeric won't fix your joints. You'll only strain your teeth yellow. Rheumatoid arthritis can be challenging. But with the right knowledge, support, and care, it's absolutely possible to live a full and active life. A question for you. What's the weirdest home remedy you've heard for joint pain? Share it in the comments. I'm sure we'll get some hilarious answers. Remember, your joints may creak, but your knowledge shouldn't. If you found this video helpful, please give it a thumbs up and consider subscribing for more health-focused content like this. And if you or someone you know is living with RA, feel free to share your experience in the comments. Your story might just help someone else. Take care of your joints, take care of yourself. Thanks for watching, and we'll see you in the next one.